All right, welcome back. If you're just joining us, it's Daybreak on Trust Television. This flight set sail at 8. So if you're just coming in, you have missed out on quite a number of issues. But whatever is left is considerably very important. You don't want to miss it. Nigeria is currently experiencing a large outbreak of Lassa fever with 4,702 suspected cases, 5 probable cases, and 877 confirmed cases between epidemiological week 1 and 15 of the 2023, that is the week ending 16th April. Among confirmed cases, there have been 152 deaths. Cases have been reported from 101 local government areas in 26 out of the 36 states, including the Federal Capital Territory. Lassa fever is endemic in Nigeria and part of West Africa, where the multi-mammoth rats, the main reservoir of the Lassa virus, is common. This morning we have in the studio Dr. Sandra Mba. She warned me not to pronounce it as MBA. Incident Manager, Nigeria Center for Disease Control and Prevention, NDDC. Dr. Mba, you are welcome to the show.
Thank you very much.
There's a popular Dr. Mba in Nigeria, so every time we mention the name, we are tempted to think we are talking about a man. So we have a different Dr. Mba in the studio. It's a pleasure to have you join us.
Thank you. It's my pleasure as well.
Every other year, this conversation come up for mentioning. And it's been with us for a while, as the intro would suggest. But what is appalling is the number of deaths we keep recording. I mean, we don't even get this from an air disaster or something. Every time it comes, we seem to know what causes it, we seem to know what we need to do, but we still lose this large number of persons to Lassa fever. Why does it appear to be such a dangerous occurrence in Nigeria? Can you please take us through all of what leads to this amount of death?
All right, so thank you very much. Good morning, everyone. So basically, we know that Lassa fever is a viral hemorrhagic fever. It is a virus. It's caused by the Lassa virus, which is largely found in the Mastomys natalensis, or what we call the multi-mammoth rats. It's usually these rats that have multiple breasts underneath them. So it's endemic in Nigeria. We've had Lassa fever in Nigeria since for over 50 years, and we have certain states in Nigeria that are largely affected by Lassa fever. So yearly we have our seasonal outbreaks. Majority of the times this usually occurs in the dry seasons between December and May. A lot of times we don't really know exactly why, but studies have shown that during those dry seasons, some areas in Nigeria especially, we practice bush burnings, and the grounds are quite dry and hot. So most of these rodents actually run from the forest area or the bushy area.
Natural habitat.
Exactly, the natural habitat, and run towards environmental homes and things like this. So Lassa fever usually presents as a febrile illness. As we know, well, we say Lassa fever. So fever is one of the first symptoms that usually people have. Usually high-grade fever, and in some cases it could also be low grade. And then you have headaches, malaise, sore throats, general body weakness. It largely looks like malaria at first, but then over time you see that it starts worsening over a period of time. So with that, we usually encourage healthcare workers to have a high index of suspicion, especially when we're getting towards the high transmission season of Lassa. We also encourage people and the public to present to the hospital early. Do not self-medicate. When you start feeling sick, you have to present. So most of the time it's usually transmitted through rodents to human. So primary mode of transmission is usually rodent to human, but in other cases it's actually human to human also. So rodent to human is when someone gets in contact with an infected rat, or the virus, or through the saliva, through the feces or the urine of these infected rats, and then maybe ingest it through food or through poor hand hygiene and things like that. in some cases during the dry season, we also know that we practice what we call drying of gari and maize and some of these foodstuffs outside because it's dry. But in a place where it's not properly protected, you can actually have you can't be there all the time, so you can actually have these rodents come around and want to eat from these grains that are spread outside, and then they defecate, or they pass urine or their saliva. And in cases like gari, where you don't really cook it and you just eat it, yeah, so you can get infected. Or when you keep your foodstuffs at home and you don't properly cover it with a seal-proof lid, so they can actually get into it, and then if you consume it improperly, you can get infected. But human to human is largely when an infected human being is sick and showing symptoms, and then that person actually is being taken care of by another person, so who doesn't practice standard precautions, or in healthcare workers case, if you don't practice IPC, proper infection prevention and control, or standard precautions. Or even sometimes it could be your family member who's taking care of you, and maybe you vomit or some fluids that come out from that body, yeah, so they can get infected. So those are the modes of transmission, and usually incubation period of Lassa is ranges between 3 to 21 days, so that's about 3 weeks. So when we're conducting contact tracing and looking at people who are affected, we follow them up for 3 weeks to ensure that they don't have symptoms or they don't develop symptoms. So when they do develop symptoms, we test them, and we ensure that they go to an isolation center where they are properly managed.
Interesting.
Okay. So the NCDC is doing a lot of work with regards to tracing cases. Absolutely. And identifying, cases of Lassa fever, yeah, across the country. But one would begin to wonder when it comes to the issue of setting out advisory and precaution. I give an example for, let's say, the change in weather from the rainy to dry season. Of course, there's always an expectation that you would expect, for example, from the rainy season to the dry season, you expect symptoms of perhaps cough and allergic reaction to the change in the weather condition. So there's always an expectation that these things could happen. But for Lassa fever, it's becoming to look like it's a recurring exactly decimal. So are there certain advisory, or are there certain things that Nigerians should look out for? In terms of you spoke about maybe from December to when May. Again? May. Till May. So are there advisories being put out whenever we get to this very high gestation periods for the spread of the virus, for Nigerians to be aware that, okay, I think this is the time when Lassa fever is going to be rampant, this is the time when I need to be more careful. And for those of us that might have symptoms of malaria during this period, we should also be more careful to go an extra mile to do tests and ensure that it's not Lassa fever.
Yeah, absolutely. So, I mean, the NCDC, as I already mentioned, ahead of the high transmission season, because it's been, over the trends of years before, over the 5-year period, you would, if you look at our website and you see our situation reports, which we have, you would see that there is a trend pattern, and then from these times where the dry season starts, the cases starts increasing. So what we do normally before those, that time of the dry season, we start sending out advisories. We send out advisories to healthcare organizations and bodies. We send out advisories to the public. We send out advisories, and we reach out to states, to the commissioners of health, and as high level as that. We send out these advisories to alert states, to alert organizational bodies, and let them know that we are approaching the high transmission season of Lassa, and therefore these are certain precautions you need to start taking into account. So of course, with the public, it's a different advice that we send out to them. We tell them, wash your hands regularly, avoid sunning your food outside, keep your foodstuffs in a tightly sealed lid. block all the holes in your houses so you prevent rodents. If you have a way to, whatever means of extermination that you need to do, because you can't tell which one has it and which one doesn't. And science is increasing, and you can't really, before we say it's the multi-mammate rats, but in some cases you've also seen cases where even other species of rodents have actually been seen to have this Lassa virus also. So things are evolving. We're not really sure as to exactly how this is happening, but there is some kind of animal mix somewhere going around. But so we send out advisories to also healthcare workers, and we start telling them to look out, to have a high index of suspicion. So when someone presents to the hospital and they having certain symptoms that look like malaria, also do your differential diagnosis. So think about Lassa fever, think about other viral hemorrhagic fevers, and not just Lassa. But it's always good to have your differential diagnosis. We tell healthcare workers to also, apply standard precautions. It doesn't matter if this is your neighbor, your child, your husband, or your family member. Always apply standard precautions of IPC so that you are protecting yourself, and in turn you're protecting the community, and you're protecting even other patients that come into the hospital during that time. So we also send out advisories to states. I mean, just as I mentioned earlier, we have some states in Nigeria, like Edo State, Ondo State, Bauchi, Ebonyi, Benue, and Taraba. So basically these 6 states accounts for over 75% of our cases in Nigeria.
We're in the month of May.
Yeah. So what we do, usually the NCDC does quite a lot with regards to, especially with high burden and hotspot states. We send out advisories to all states. We ensure that they start, understanding that we are currently getting towards the high transmission season of Lassa. Therefore, everybody needs to start have a high index of suspicion. We have what we call the disease surveillance notifications officers and the state epidemiologists at these states, at every state. Disease surveillance notification officers is in every LGA. So we ensure that they start conducting, active case survey. They start looking out, their surveillance is more heightened during this period. Risk communication activities are going on at the local levels down to the community, ensuring that people are reporting what they see. We have community community workers who support the states as well, and they ensure that they look out for things like this. So we also ensure that we do what we preposition commodities. So the NCDC actually supports states by prepositioning both medicines with regards to management of Lassa fever. We also preposition PPEs, which is preventive equipment that these medical workers wear to manage these cases. We also preposition reagents, which is for laboratory diagnosis. So we have about 9 labs in country across different states, including the National Reference Laboratory here in Abuja. And we're trying to also expand to have more, to see if we can actually get up to 15 or more labs to manage and to be able to diagnose Lassa. And we have treatment centers across states as well. We have over 20 treatment centers across Nigeria and across different states that manage Lassa fever. So we support states with regards to this. We also sometimes, in certain cases, we support treatment centers with capacity to manage. So in some cases, we help centers that are overwhelmed with surge staff. So this year alone, we've actually, we're supporting 6 treatment centers with surge staff support. So this is just because of the magnitude and the increase in numbers of cases in the treatment centers. So we're supporting them with that manpower support that they can manage. We've also actually deployed rapid response teams to states. We've deployed to 6 high burden states that I mentioned earlier. So they supported the states for a period of I think a couple of weeks, maybe almost a month. So in these cases, we support states in every way that we can to be able to fight this disease.
All right. 2 things come to mind, especially for those 6 states you mentioned, and they seem to be close to each other. So there's Benue, Ebonyi, if I recall. There's Ondo and Edo, who share border, if you like.
And there's Bauchi.
And then there's Bauchi. and Taraba.
Yeah.
Is there a reason why this, is there a particular practice why these 6 states continue to
appear on the radar,
and recording 80% of the cases? That's one.
Okay.
Why do we always have that high mortality rate? Is it a function of people not reporting early or coming in at the terminal point? What exactly are we doing wrong to be recording this huge amount of mortality?
Okay, so for 2 questions that you asked. So the first question really is why these 6 states? So I would want us to take us back a bit and actually let us know that this year, in this current epidemiological year, from week 1 to week 16 where we are, we have actually recorded over 890, I think 97 cases, 877 confirmed cases across 25 states, right? So this is not just, in these 6 states. Yeah, so these are states that have recorded at least 1 confirmed case in Nigeria. And then, across, we have over 90 LGAs as well that have been recorded, that have recorded these confirmed cases. However, we do have these 6 states which are the high burdens, and there's no particular reason why these states have kind of
tempted to take that because they do a lot of rats chasing.
So, but in some cases you have situations where some states practice certain behaviors, right, that may predispose you to coming down to certain issues like this. Honestly though, we don't know exactly why these rats are more or found more in these states. We also don't even have, I mean, science is still evolving. We also know that rodents are constantly moving. They also proliferate quite quickly.
That's right.
So naturally, I mean, I think it's every 90 days, scientifically proven. So these are certain things that we need to think about. There's no particular reason as to why, but what we are trying to do is really focus on how do we prevent this disease, and how do we prevent the burden to reduce it. But when you talk about the deaths, now we record deaths from Lassa fever, but it's good to also note and take us back a couple of years and actually remember that a couple of years back, the deaths were so much more higher, but because of the constant involvement, because of improvements in surveillance, improvement in diagnosis capacity, improvement in management, improvement in risk communication activities, improvement in logistics, improvement in IPC and sending out the right message to everybody, we've actually reduced our case fatality rate. Now, we're not where we ought to be, but we're slowly getting better. We're much better than where we were. So, yes, right now our case fatality rate, I think it's about 15 or 17%. But there was a time where we used to have 50%, case fatality rate, which means, almost everybody who comes down ends up dead. But we have improved, and we're improving. Of course, there's more work to be done, but our surveillance capacity has improved. The NCDC has what we call the SOMAS, which is the Surveillance Outbreak Management Analysis System. So this actually gives us real-time data reporting across all the states in Nigeria down to the local levels. So these are areas of improvement that we've recorded over the time in Nigeria at the NCDC, and we're currently seeing how best we can improve further. And we're also improving in our research capacity. Just yesterday we concluded a 2-day Lassa fever research colloquium. And this colloquium, basically, the overall aim of this colloquium was to bring out a 5-year Lassa fever research agenda, and that prioritizes, that kind of gives light to key research priorities in Nigeria. So when we talk about preventions, we can't really do a lot of preventions activities without research. Research actually plays a good role in some of these activities. We also developed our 5-year strategy plan, Lassa fever's 5-year strategic plan, and this plan really just the overall aim is to see how we can reduce our case fatality to at least 1 digit. So currently we're 17, so 17 is a 2-digit number. So if we can actually further reduce the case fatality to 1 digit percentage, that would be a huge success for Nigeria and for the NCDC.
All right, just for clarity, especially for some of the states you mentioned, does the habit, because you talked about certain habits, of eating bushmeats or bush rats or these particular types with those
the multi-mammoth rat,
yes, does it have any impact on contacting Lassa fever in a way? Because I mean, you talked about the cases of Gary where they are not really boiled, you just basically pour them in warm waters or cold waters, as the case may be. But with these bush rats, they are processed. They go through heat and all. Does it increase in any way? Are there chances that people who consume them would also stand a chance of contacting Lassa fever?
For the sake of the audience.
So, I mean, we're not sure exactly how. Now, when something is processed, how do you know that's properly processed, right? And then you also think about the person who's processing it. So whoever is going to have contact with this rats or bush meats, during the processing stage, that person can also get infected, correct?
Correct.
Now, if something is also processed, you don't know how, if it's poorly cooked, if it's good, well cooked. So some of these things are factors that you can't really say this is the reasons why. Neither can you say, this, you should do this. But what we do advise is to avoid things like that. So avoid bush meats, especially when we are in certain seasons, right? But naturally, I would say avoid it as much as possible, because you don't also know, sometimes we're not really sure what it is we're consuming when it comes to these bush rats or bush meats, rabbits that we see. Neither do we know what how whoever processed it actually, if they how well they did it. So it's better to avoid. I think in those aspects, prevention is usually better than cure. Prevention is always better than cure.
Okay, so earlier you mentioned that the NCDC has about 20 treatment centers across the country. So still for the sake of our viewers, because I know that this question would be on their mind, because it came to mind the moment you mentioned that, who bears the cost of treatment? That's one. And then secondly, does the NCDC still carry out expectedly contact tracing as was done during COVID and other outbreaks?
Yeah, so absolutely. As I said earlier, we collaborate. So what we actually do especially when we are in the high transmission season, at some point we do what we call a risk assessment, right? Okay. So when we do a risk assessment, we assess the risk of the disease at the current time, looking at every other factor that we take into place. And this guides our information to see if we're actually going to activate what we call the emergency operation centers. So the emergency operation centers is the coordinating board that literally just coordinates the entire response of Lassa for the country across the affected states. Now, at the state level and at subnational level, we have actually gone ahead to support states to establish state emergency operation centers, what we call the state primary health emergency operation centers. So every state in Nigeria has this emergency operation center, and it's not just for Lassa. This is really across all public health diseases. So for COVID-19, we had EOCs, across all the states as well, that was coordinating the response of COVID as well, and every other diphtherias, monkeypox, and so on. So these EOCs activate upon the, when a disease has been, when the risk assessment has been done and that disease has been seen to actually be of a risk. Now, states can also activate their EOCs based on what is going on at the state, even before the national activates the EOC. But once the national activates, it coordinates it across every state that's been affected. So during these periods, we actually support states to ensure that their response to Lassa fever is optimal. We support them. We also support them with contact tracing support if they need it. Now, at the state level, the state is also able to coordinate certain responses for themselves, and we also encourage states to take responsibility in even leading some of these responses, because we are providing support. We're not going to take over from your state and you know, help, you know, do that, but we'll provide as much support as we can. So states usually take a lead with contact tracing activities. They ensure that every patient that has been confirmed their contacts are traced and followed up, just as I said, for 21 days. And then if they need support with contact tracing, of course they communicate, and we see how best we can support them. So it could be in, you know, different ways that we see or that they require. And then we also, for the management aspect, it's good to also let the public know that ribavirin is free. So at the treatment center level, anybody who's tested positive for Lassa is managed. Well, ribavirin is free. However, when you do other, yes, because ribavirin is the drug of choice for, well, currently that is being used to manage Lassa. The Nigerian government has ensured that this is distributed across all treatment centers and tertiary facilities for free.
Okay.
So when a patient is being managed, they do not charge them for ribavirin. However, they also do not charge them for testing Lassa fever. It's free. But you do know that when you're being managed, you know, you have other, you know, cost expenses with, you know, other medications that might be needed, you know, antibiotics and all the other aspects that may be introduced. So those aspects are not free because that's at the, you know, a prerogative of the facility.
Okay, but are they affordable?
Well, it's quite. So it depends on so severity of the disease also plays a factor. And sometimes in cases we encourage patients and we encourage public to present early to the facilities, because early presentation actually allows you to start receiving management early enough. And in turn, you probably, the likelihood of having severe disease is very slim. You're able to get treated quickly.
Okay.
When you delay presentation, you may have a likelihood of being severe. Okay. And now being severe may also cause some complications with what Lassa causes. So Lassa can cause, you know, multiple organ failures, especially with the kidneys. And then you would need dialysis and all of those things, which are not very, you know.
So as we had with the COVID, are there underlying issues that could worsen the Lassa fever should one pick it up and you already are managing some form of illness? Is it applicable? Yeah,
well, just as I mentioned, Lassa fever can cause multiple organ, you know, failures. So, and those are in severe cases. So with people who have, you know, already existing comorbidities, right? Like, you know, diabetes, hypertension, and certain comorbidities could be, could pose a higher preposition or predisposition to actually having more severe cases because of the underlying issues that they already have. But early presentation to the facility usually is your best bet if you are sick and if you are tested. However, we encourage people to, you know, as much as possible, prevent.
All right. Before we let Dr. Sandra go, how much of these collaborations you talked about with states also include faith-based organizations, community level participation, especially because that is likely where these persons can be better mobilized, given that we are predominantly members of two major faiths, and we probably will be listening to their faith-based leaders more than they would government agencies.
So whenever we support, you know, states, or we send out these advisories, we also reach out to faith-based, especially if we're going into communities. We ensure that we also pay advocacy to community leaders, because it's very important. And these are people who, you know, who are championing the community at large. And also we also, you know, reach out to, imams and, pastors and so on and so forth, because we know that it's a whole of approach. And just to also note and really say, which is very key and very important, Lassa fever management is actually coordinated as a One Health approach. So when we say One Health, we're not just working as NCDC alone. And even when we, carry out our, response activities to states and to, across board, we actually conduct this with the Federal Ministry of Environment and Federal Ministry of Agric, because it's all encompassing and it actually affects everybody. So Federal Ministry of Health, Agric and Environment. So whenever we actually have response activities, we also go as a One Health approach. Even at our EOC at the national level and state levels, they actually have representatives from all these bodies as well that are very much involved, as well as multiple stakeholders and partners that support us and support Nigeria with quite a lot of these responses.
Interesting. Moments of education, moments of enlightenment, eye-opening moments there, especially for those of you who can stay away from bushmeat. Now you know the attendant risks attached. You want to risk a Lassa fever, or just do away from the bushmeat for a particular period of time, or find alternative. Find alternative. There are several chicken hotspots and suya hotspots, that can make up for that. Dr. Sandra Mba has provided sufficient enlightenment in this program, and I hope you have found that very educative and very enlightening, and you have drawn very useful lessons from the things that she had said this morning. We want to thank you for finding time to be here. We know how busy your schedules can be, especially at the height of this event. We hope that we'll find time to bring you again.
Yeah.
Maybe not on Lassa fever, maybe on some other things positive. Once again, thank you very much.
Thank you very much.
All right, Nigerians, we want to thank you for allowing us free access into your living room. We hope we have been able to meet your expectations. Let's do this again tomorrow. I am Sunday Michael Ogu.
And I'm Sagir Ibrahim. Do well to vote for Trust TV in the upcoming TV awards organized by the Broadcasting Organization of Nigeria. Thank you for watching, and see you next time.